Also new this morning, the Trump administration finalizing the 2027 payment rate for privately run Medicare plans to 2.48%. That is an increase of over $13 billion. The move sending major health insurance stocks higher yesterday. The move continues this morning. And joining me right now is the Deputy Administrator for the Centers of Medicare and Medicaid Services and Medicare Director Chris Klomp. Director, good to see you. Thank you so much for being here. Assess what you are doing. Dr. Oz says this update ensures patients get real value from their plans.
That's right, Maria. This wasn't just a rate notice yesterday. This was a down payment on President Trump's promise for a more accountable, more affordable, more patient-centered healthcare system. The President has directed us to drive affordability for the American people, and that's exactly what we did yesterday by holding insurers accountable. Many expected the rate notice to be higher, and it was not. It's in line with GDP, although that's about half of what underlying medical costs have grown over the last year. With this notice, we're sending a loud message, not just to insurers, but to healthcare providers broadly, that the days of unlimited rate increases are over. They must control costs for the good of the beneficiary. We're focused on two things at CMS: stability for the program and long-term sustainability of the program. Stability, we want patients to have the providers that they want, to have the plan that they want, to have the coverage that they want. We want it to be convenient. We want it to be a great experience. But we also have to be wise stewards of taxpayer resources. The plan needs to sit. It needs to be around for decades. We can't be talking about the Medicare Trust Fund expiring within single-digit years. Yeah, and so yesterday was a start on that promise of the president.
Well, I like the idea that the president is keeping a hold on everything. So while we see oil prices are elevated as a result of taking down a would-be nuclear terrorist, we also have other parts of the administration ensuring that, whether it's most favored nation status or what you're doing specifically at CMS, is keeping prices lower and coming down in health care.
That's exactly right. It's not just the rate notice and what we're doing with insurance premiums, although that is significant, and not just for the 68 million Americans who are on Medicare, but for all Americans, because as you know, where Medicare goes, so too does the rest of the market. But you mentioned most favored nation drug pricing. This is the first president in the country, as long as we've been tracking drug prices, that's lowering medications, that's solving the problem for a quarter of Americans who can't pick up a prescription when they get to the pharmacy counter because they can't afford it. Right now, if you need a GLP-1, you're now paying half of what you were paying just a couple of months ago before he announced those deals. If you want to grow your family, you need to pick up fertility medicine. Again, you're paying about half for those drugs, saving you thousands of dollars per cycle of treatment than you were just a couple of months ago. And he's not stopping there. He's driving historic actions on price transparency. We know that informed consumers are empowered consumers. They shop for health care rather than having health care foisted upon them. You know what happens when people shop? Competition. Competition benefits the consumer. People choose lower prices and better quality. They choose against low quality and high price. The consumer wins. Bad performers are run out of business, or they change their ways. They improve. Either way, the consumer wins, and the president is driving that set of changes.
No, this is important, Liz, because this is one of the more important issues for voters going into the important midterms. We can't forget about the fact that the midterms are around the corner. Okay?
Right upon us. Yes, I mean, a new Gallup poll came out today showing that by far and away, the most important thing to Americans is health care. The people are concerned about it. They're concerned about the affordability. So you bring a very welcome message. And my question to you is, how do you get it out there? How does America find out that we're actually lowering prescription drug prices and that these things are happening? Because I think nothing could be more important, to Maria's point, as we look into the midterms.
Well, I love that you're getting the message out. The president will continue to speak about this. Most important is every time those consumers go to the pharmacy counter, they go to their provider, they don't see rate increases that are dramatically higher year over year in their costs. They're going to understand it. They're going to see it. And I hope they'll give the president credit for the work that he's doing. He is extraordinarily focused on this topic. This is something that every American needs to have. Health care. Most Americans don't care about their health care until their loved one loses their health. That's what he's delivering on, is affordability for every American family to be their healthiest self.
The administration is also considering a policy to automatically enroll seniors in a private Medicare Advantage plan or an accountable care organization which participates in the Medicare Shared Savings Program. Tell us about that.
Absolutely. We've known for a long time that if a patient is served by a provider who's in an accountable relationship, a value-based arrangement, meaning that provider is paid not just to render services, but to actually help the patient live their healthiest life, to control their blood pressure, to solve issues with chronic disease, et cetera, that patient outperforms. Every single metric that we track at Medicare, a patient outperforms if they're in an accountable relationship. That could be through Medicare Advantage or Medicare Shared Savings. Either way, it beats fee-for-service every day of the week and twice on Sunday. So we are considering ways to help patients automatically understand and select into programs that will help them lead healthier lives so that they can reach their full potential, so that we as a country can reach ours. It's still early days. We're thinking through how we best effectuate that. First and foremost is choice and competition. We want our beneficiaries to choose the care that is best for them. But if we can help them understand what's best for them, how to get that best care, everybody wins.
I like it. We're watching your work, Chris. Important work. Thank you, sir.
Thanks so much. We appreciate it.
Chris Klomp joining us. Stay with us. We'll be right back.